Hello, everyone. Good morning or good afternoon, depending on where you're watching from. Welcome to Mental Health America and GeneSight's Facebook Live event is Manning Up, Bringing Men Down. Today's event is a joint effort between our two organizations to recognize Mental Health Month, Men's Mental Health Month. So this month is dedicated to raising awareness about mental health issues affecting men and boys. So during all of the month of June, both MHA and GeneSight are engaged in activities that seek to reduce the stigma surrounding mental health for men, encourage open conversations, and promote access to resources and support for men struggling with mental health challenges. So even before the pandemic, the US was experiencing a significant mental health crisis, and the pandemic only exacerbated it. Last month, MHA focused on May's Mental Health Month, which we founded in 1947, focusing on the mental health and well-being of all. This month, our resources and activities highlight that men's mental health is a crucial public health issue. So today's conversation is going to focus on how societal expectations and traditional gender roles often discourage men from expressing their emotions or from seeking help, leading to significant mental health disparities. And statistics really do reveal the severity of the problem across a range of conditions. So we know that men are less likely than women to seek treatment for depression. And studies do indicate that approximately 6 million men in the US suffer from depression each year. For suicide, the suicide rate among men is very, very high. In the US, men die by suicide 3.7 times more often than women, and middle-aged men in particular are at the highest risk, with suicide being the seventh leading cause of death overall among middle-aged men. And also, of course, we know that men are also susceptible to other mental health conditions. So men face higher rates of substance use and substance abuse disorders, often as a coping mechanism for untreated mental health issues. And we know that conditions such as anxiety and PTSD may also go undiagnosed in men due to societal pressures to tough it out or to suck it up. So today we're going to be exploring really the evolving definition of masculinity and how that plays into mental health. So we know that the traditional definition of masculinity really has long emphasized stoicism, self-reliance, and emotional suppression. However, there is a growing movement toward redefining masculinity to include vulnerability, emotional expression, and seeking help when needed. This shift really is crucial to encouraging men to prioritize their own mental health and well-being. So, as we'll discuss today, promoting a more inclusive and compassionate understanding and conceptualization of masculinity can help to break down those barriers that prevent men from seeking mental health support. By challenging these outdated stereotypes and fostering a culture of openness, society can better support men in their mental health and their whole overall mental health journey. So Men's Mental Health Month, which we've been observing throughout the month of June, serves as a vital platform to highlight all of these issues, advocate for change, and support men in leading healthier and more fulfilling lives. That said, we do have a very distinguished and esteemed group of panelists with us to have this conversation today. So first, I'd like to introduce Tyrone Quarterman, who has a master's degree in public health. Tyrone is Senior Manager of Health Equity and Diversity at Myriad Genetics. We have Dr. Bernie Ranchero, who's a diplomat at the American Board of Family Medicine and the American Board of Obesity Medicine. Dr. Ranchero is Medical Director of the Coles County Public Health Department, Medical Director at Leadwell, and Clinical Assistant Professor at Carle, Illinois College of Medicine. And then finally, we have Dr. Ryan Griggs, Senior Medical Science Liaison with mental health at Myriad Genetics. And again, I am Nate Tatro with Mental Health America. I'm Vice President of Alliance Development. So panel, let's kick this off. So this event title asks the question, is manning up bringing men down? What we mean, like I said earlier, is that the traditional image of masculinity imposed on men seems to discourage men from showing emotions for a variety of reasons. And yet we do know that many men struggle with their mental health, and recognizing the signs and communicating those is an important part of mental wellness. So let's start this conversation with you, Ryan. So part of the reason we're having this conversation today and why Men's Mental Health Month is so important is because it seems to be that conventional wisdom is that men don't like to talk about their mental health. Now, that could be due to stigma or other reasons. So I'm wondering, is that true for you? And why, if so, why do you think that's the case?
Yeah, that's a good question. I would say yes, it's true for me until I started working at Myriad with GeneSide, a mental health company. I was spent 10 plus years in a rugby culture playing rugby, which is tough it out from both a physical and a mental perspective. And that translated to personal lives and all the people I knew. People did not talk about what was bothering them, if they had depression, anxiety, if they had life trauma that impacted their well-being. It was always a culture of onward and being that masculine image. You know, I don't know what there's a lot of stereotypes that are surrounding that, and that's kind of what we're talking about today, and that could be one of the causes of that. And for me personally, I definitely had some past trauma and experiences that impacted my mental health. And I was fortunate enough to be in a privileged space, being on a college campus, having a girlfriend at the time, now wife, that is a psychologist and very supportive of emotional vulnerability and talking to people about mental health issues. And so I was kind of able to break out of that stereotype and seek treatment. But not everybody can do that. And I think that's an important part of what we're talking about today.
Thanks for sharing that. So you just ended that with not everybody can break out of that stereotype or break away from the stigma. And you mentioned that you played rugby. Did you notice any of your teammates who also seemed to struggle with it? Either did they share anything with you? Did you just observe it? Was it part of the culture?
I, I I'm not sure about that, but what I can say is I'm thinking back to all my connections with friends, teammates, et cetera, over the past 20 plus years. And I can't think of a single person that's sought out treatment for anything related to mental health in the men that I know.
Thanks so much for that. Tyrone, let's bring this over to you. So, if you're willing to share, have you personally experienced depression or anxiety, or have you noticed family or friends, other men experiencing depression? And if you have, were the signs obvious? Were they more subtle? How did you help them? What did you suggest to them? But first, if you're willing to share, your story, we're all ears.
Absolutely. So, I'd like to think I've been pretty open about this thus far, and I'm always, willing to share my experience. So, I've absolutely dealt with and still kind of deal with to this day a level of depression, more so anxiety. And this is something that, I discuss with my therapist and interactions on the best ways to kind of mitigate that. I think that it's okay to accept that you're dealing with these things, and it's okay to be upfront about them. And that's something that I think we as men personally need to feel more empowered, right? And one of the ways to do that is to hear other people share their story. It absolutely manifests in different ways. For me, I'm a very hyper fixated person. I also played sports, like my colleague Ryan here did. I was a football player for the majority of my life. And when you have a craft or when you have an interest or you dedicate yourself to something, and especially when that goes away, right? We can't play it forever. It's very easy to try to fill that void in other areas, especially if you like to fixate on things as I do. So for me, and I'll kind of focus on the anxiety more so than the depression piece. But for me, I think it was consistently worrying about, am I doing enough, or am I putting my time in the right places, and just kind of seeing the physical kind of manifestations of that, right? The nervousness, the heart rate, the mood swings, all of those things, those symptoms that come along with these conditions. And you don't really know how to put your finger on it until you talk to someone, you talk to a professional, you talk to your support system, and they kind of let you know, hey, you might be dealing with some depression or anxiety, or, because this is not you, right? I would say for my friends, right, I've dealt with these, but I also have friends who have dealt with this. And it's always easier, I think, to see it in other people than yourselves, or at least it was the case for me, because I recently, myself and some of my college roommates, we recently had to kind of talk to a friend of ours who's dealing with depression in a really, really a strong case of it. And I don't think he personally was really receptive to it at first. But, you know, again, as his support system, we kind of had to come together and level set with him. You know, we think that you're not yourself. You're not exhibiting the characteristics we're used to in you. And so we were able to kind of get him to some professional help and some more support systems to deal with that. But I've definitely dealt with it and still continue to do so to this day. I have friends who deal with those to this day. And I think it starts with just accepting that, you know, it's okay to admit these things. And then that's the first step to improving your situation.
So it really sounds like for you and maybe for some of your friends, or as you call them, you know, your support system, it started off earlier with a blend of both self-recognition and also other recognizing the signs, right? So you said you noticed you had an increased heart when it came to anxiety, you had an increased heart rate, you noticed some physiological symptoms, but then you also had a strong network where you could talk to people about this. Do you think that was, I mean, so we're talking today about the barriers that men can experience about talking about these symptoms. Have you noticed over time that it's become easier as more of you recognize the signs and symptoms in each other? Or is it, do you think it's a product of, you know, everyone, we all get older, and do you think it's just a product of getting older and building on these relationships? What do you think has contributed to recognizing the signs and symptoms and breaking down those communicative barriers as you've gotten older?
Yeah, great question. And, you know, I think that the concept of mindfulness comes up here as being so pivotal, because being aware of yourself and your relationships and the personalities and the characteristics of not only yourself, but the people who you care about, I think that goes a long way into the recognition piece, right? So for me, like I always say, I like to fixate on things. I'm a very kind of committed person. When I find things I like or I care about, I stick to it and give, you know, full effort. And so it's very easy to have the anxiety manifest, just kind of as an example, in a way that, okay, I feel my anxiety rising because I'm kind of scared to do something out of the ordinary, or, you know, I'm really sticking to what I know and I'm not really challenging myself. But that's because I'm aware of who I am, right? I take stock of myself. I take time to, you know, meditate and just kind of take time to myself, really, and understand my characteristics and what makes me me, but also doing the same for my friends, right? And my loved ones and families, taking stock and understanding the personalities and the characteristics of people you care about. So when you see things that change, or things that don't look, you know, in accordance with what you know about them, right? Then you can stop and say, okay, is this due to just a temporary situation, right? You talk about it, we get older, we have families, we have kids, we have all these external factors that may change for the moment. But if you're starting to see that as a systemic issue, as a continued issue, then that's when it's time to speak up and say, hey, friend, I think that you may be dealing with this. And it's okay to bring that up, because I'm saying this from a point of care and love, not from a point of, you know, pointing fingers or anything like that.
That's really interesting. I mean, Ryan, did you want to add anything to what Tyrone was saying about sort of your journey and how you've grown over time in recognizing the signs and symptoms, or anything about how other men or your social support network has helped you over time?
Yeah, for sure. One of the words, intervention, resonated with me. And what I noticed about myself in my sort of trauma-related depression was irritability. And both of those things are related to traumatic deaths of both my parents, my mom when I was 8, and who died in a car accident, and my dad, who essentially killed himself with alcohol when I was in my mid-20s or so. And I have 2 young children now. And so those thoughts and feelings about those incidents in my life are now very prevalent because of seeing my kids. And in the past 6 months, even, that led to me seeking out care in terms of going to see a therapist and talking about my life experiences, telling my primary care physician, like, hey, I'm not feeling very good. And we can certainly punt that one to Bernie. And One of the things that helped me recognize that was a support system and increased screening for depression and anxiety in the primary care realm. And maybe Bernie could talk a little bit about that.
Yeah, I mean, thanks. Yeah, so we'll hop on that segue. But first, thank you so much for sharing that, Ryan. Part of what Mental Health America's slogan is, that goes back to our founder, is "I must fight out in the open," and sharing these stories about recognizing your signs and symptoms and destigmatization and validation of these experiences as contributing to your life. It's what we're all about. But what you just said, Dr. Ranchero, if you could respond a bit to what Tyrone and Ryan talked about in terms of their own journey of self-recognition and seeking help. As a primary care physician, Ryan just mentioned screening. MHA has our National Prevention Screening Research Program. We've done over 26 million screens to date, 1.6 million for depression. 400,000 of those are screen positive for severe depression. As a primary care physician, is it part of your practice to give regular depression screens to your patients?
Absolutely. First off, let me just say for Tyrone and Ryan, it's great to see strength and courage exhibited in both of them for recognizing, first of all, that they needed and they wanted to make positive changes in their lives. I think one thing in primary care that I emphasize, is about prevention. It's about asking the patient, yes, of course, I want you to live a long time, but what kind of quality of life are you having? So at every visit, my nurse asks 2 questions. And these questions are from the patient health questionnaire. It's called the PHQ-9 patient health questionnaire. We start out with 2 questions. First question is, over the last 2 weeks, how often have you been bothered by any of the following problems? And it's rated on a scale of 0 to 3, with 0 being not at all and 3 nearly every day. The first question is, do you have little interest or pleasure in doing things? And you rate it. And then the second question is, do you feel down, depressed, or hopeless? And then it goes again, not at all, several days, more than half the days, nearly every day. But if any of those come back positive, then my nurse goes on and asks the following questions, whether it be about sleep problems, energy, appetite, feeling bad about yourself, trouble concentrating, speaking slowly, or being fidgety. And then the last question is, would you be better off dead or hurting yourself in some way? And then if any of those are positive, then we ask the questions, how has that affected you? Is it made life difficult for you at home or at work? Then we rate the patient, and we can get a objective score. And from there, we can determine if that patient has depressive symptoms, and we can track that and follow that. And this is a powerful, validated tool that we can use to not only screen patients, but identify how they're doing with treatment. But I think the big thing is, when it comes to masculinity that you were talking about earlier, is that recognizing that, we as men oftentimes in our society believe that we have to have it all together all the time. And that's not true. And I always tell my patients, we take better care of our cars, our trucks, our tractors, or whatever than we do our own body sometimes. We know when something's going wrong with a car. It sounds funny. It's driving differently. Well, shouldn't we be even more attuned to our own bodies and our own mental status than a car, than a pickup truck? And don't our families deserve more than that? And so really, like I said, I applaud Tyrone and Ryan for sharing their stories. I also suffer from anxiety and depression, and being part of the LGBTQ plus community, there's even more, if you will, pressure on masculinity and the roles you play. And so, recognizing it, that is not a weakness, and asking for help is a strength.
If I may, just to quickly respond, so thank you, Dr. Ranchero, for that rundown, because I think a lot of people needed to hear that. And just kind of going off the car analogy, for those of us who care about our cars and care about a lot of things, you think about an oil change, you think about rotating your tires, you think about that general maintenance. It very well could be that your car is in great shape and you don't really need to do anything, but you need to check it out, right? You need to make sure that I heard a little rumble or I heard a little wobble and it just didn't feel right. And for me, going through the screening process, I think I'm in a pretty good space now, but when you have those screeners and you can at least see some of those core components, well, have I had suicidal thoughts? Have I been kind of eschewing my responsibilities? Like being able to think about those things and have a healthcare setting where you can discuss that goes a long way, to your point, to the preventative aspect.
And thanks so much, Tyrone. I'm going to build on that and bring it back to Dr. Ranchero for a follow-up. So, when you went through the PHQ-9, which is what we take, what we offer on Mental Health America website, basically a PHQ-9, you talked about the symptoms that Tyrone just said that can manifest: anhedonia, right? Lack of taking pleasure in things you used to enjoy, hyposomnia, sleep issues. When you give that PHQ-9 and ask, you're able to identify and highlight these symptoms to your patients who come to you. Do you notice a disparity in the way that men or women may react to, oh, you have a positive screen for depression? Oh, can I ask you some follow-up questions? Or, it says you aren't sleeping well. Do you see a disparity in how people react to that? Is there validation, or is that, I don't sleep well, it's because I have a lot on my mind? Is there a difference between men and women?
Absolutely, there's a difference in it. Unfortunately, it's the societal bias that we have of that we need to project this image of masculinity and strength. And unfortunately, oftentimes when it comes up, it's when that patient, that man has hit that wall or has hit rock bottom. They've done something where, someone says, Dr. Ranchero, I need your help because my family's going to leave me, or my relationships are in turmoil, or my irritability is affecting the people around me, or I can't, maybe they had a DUI, maybe they had an outburst at work, something has happened. And when it comes down to it, the other thing that I see is that I see high blood pressure. I see other things where depression, unfortunately, and anxiety is manifesting itself in physical ways, whether it be reflux, whether it be headaches, whether it be insomnia, all these things, whether it be obesity, alcoholism. So sometimes at the root of things is this anxiety and this depression and behavioral health, and it's manifesting itself in physical ways.
So so what I'm hearing is, it sounds like one of the disparities between men and women is the timeline for when they recognize these symptoms have become a problem. It sounds like men more often, probably not always, but more often seem to already be in some sort of crisis, right? Compared to women in terms of recognizing it and taking action. One of MHA's standard bearing sayings used to be before stage 4, right? So analogous to physical illness, you wouldn't let cancer or heart disease get to stage 4, which is in crisis mode. So you shouldn't let a mental health concern get to stage 4 in crisis mode. And that, upstream prevention with recovery as the goal really should be that guiding star when doing an assessment and when trying to get services to people who need them. One thing I want to read a couple of statistics to this group and get your feedback. So in a mental health survey from last year, a significant number of men, and Dr. Ranchero just touched on this, admitted to heavily engaging in a variety of unhealthy coping mechanisms, from taking stimulant drugs to gambling to drinking, or even to using social media. And more than 1 in 4, 28%, said that these coping mechanisms helped when they were dissatisfied with their mental health. Of course, as we all would know or suspect, experts are going to say that these actions do more harm than good, right? It's not good to excessively drink or use substances or even go on social media. So, I'll bring it back to this group. First, Dr. Ranchero, can you kick it off? Have you seen this in your patients in men? Do they tend to, and you already kind of answered this, do they engage in these more self-destructive behaviors? And when you observe it, how do you talk to them about it if you do observe it?
You know what? First off, it could be patients using cannabis, using alcohol. It could be patients going to an extreme or feeling compelled to do many other things. And there's some healthy compensations that we can do out there that we can modulate. But at the same time, it's recognizing that when you're under chronic stress, it affects the neurotransmitters in your brain. The neurotransmitters of serotonin, norepinephrine, dopamine, glutamate. And so when you're under chronic stress, you don't realize that your brain chemistry changes. And it's letting those men know that, wait a second, this is affecting you and it's affecting your brain chemistry. And it's coming out physically now. It's coming out in your relationships. It's coming out in your behaviors. And correcting some of those chemistries is very helpful. And that's one of the things that we can offer patients, is to say, hey, correcting your biology, correcting your physiology of what's going on is one solution. But I also want to plug in there the importance of therapy. I'm in therapy myself. Ryan Sheridy's in therapy. Tyrone Sheridy's in therapy. That's important, you know, and I always tell patients there's no side effects to therapy. There's always side effects to medicines. There's always things, sequelae to medicines, and consequences of taking medicines, whether it be short-term or long-term. But getting out there and getting a good support system, getting into therapy, and first recognizing that, hey, I need help.
How about you, Tyrone? Since he just mentioned you, have you experienced yourself, or have you seen some of these other unhealthy behaviors in order to compensate for a mental health concern?
Yeah, so I've definitely noticed in myself, again, I'm always going to say my personality, I fixate on things. So, you know, I've engaged in healthier and unhealthy behaviors to kind of, I guess, modulate the anxiety and depressive responses. And even in my professional capacity, a lot of the work I do is based on kind of community level interaction. So I often get to interact with communities of men, particularly, for the sake of our conversation, Black men, men of color. And a lot of what I see can be related back to really kind of cultural, deep rooted kind of cultural beliefs, right? I think it's no it's no far stretch to say that we as a society, right, at least here in America, we rely on alcohol a lot, right? It's hard to go somewhere without seeing advertisements or hanging out with people without there being some sort of alcohol or drug around. And then when you break it down into individual cultures and individual, kind of societies, people have their own ways of adapting, right? So it's not a stretch to say that, unfortunately, some of this is popularized. And so it's going to be tricky to completely avoid it, especially as a response to stress or whatever you may be dealing with. But as Dr. Ranchero and even Ryan mentioned, recognition is important, right? Recognizing, all right, this may be a little bit too much, right? I'm kind of relying on this outlet, and I'm not really handling my responsibilities, or it's not allowing me to be the person that I want to be or the person that I think I am. And to Dr. Ranchero's point, your brain chemistry is altered. So it's hard to recognize that without a support system in place to tell you, or at least give you that platform to recognize it yourself. But I definitely have noticed it between my personal and professional engagements.
Ryan, is there anything you'd like to add on the topic?
Yeah, both Tyrone's and Bernie's recent comments really hit home for me in watching my father's trajectory. He spent his life in a job he hated to support his family because he was manning up, and he retired and had nothing else to do but drink. And that drinking led to reflux disease. He would eat food and not be able to swallow it because of how bad it was. It led to thyroid issues. It led to hypertension. It eventually probably would have led to diabetes. And he coped by drinking. And then he got a DUI, and we got him into rehab. And rehab doesn't work if you don't want to get better. And we got him into rehab again, and they tried to make him stop smoking cigarettes, and he wasn't going to do that and quit drinking. And it eventually progressed through that stage 4. And not once did we ever consider maybe he was depressed, and some therapy and an antidepressant would have gone a long way for him. And so I think the message there is just seek help early. Don't wait.
Ryan, so to build a little bit on that, you just said seek help early. So Mental Health America's theme for May is Mental Health Month was Where to Start. And that's actually based on the book that we published. It came out in paperback this year called Where to Start, about, what are the first steps someone can take about recognizing that there may be a mental health concern and then eventually getting help. If you do you have any thoughts to build on what you just said about what could those first steps be? Because it sounds like you have a lot of experience both with yourself and within your family.
Yeah, I think one of the things Tyrone mentioned earlier was acceptance and that recognition that, hey, something's off. And now what do I do? When I have spoke about this previously, I say reach out and ask for help. Lean on your network, lean on your family, lean on your friends, lean on your employer-sponsored mental health programs. Talk to your OBGYN, talk to your nurse practitioner, talk to your Dr. Ranchero, or talk to Bernie, talk to your primary care physician. Talk to anybody who will listen. And there's lots of things that we can use. We have lots of tools to treat mental health conditions, therapy, medications. There are other tools. If you accelerate along the treatment process, there are personalized medicine tools like pharmacogenomics that can help Bernie decide on which medication or at what dose he's going to give you. All of these tools work in many people. But you can't gain access to the tools until you ask for help.
If I may, just to kind of add on to that, Ryan, because I think you summarized it exceptionally well. Let's bring it back to the title, right? Is manning up, bringing men down. For so long, we've been, kind of under this pressure to be quiet when things affect us. That's not really manning up, right? I think manning up is being empowered and not being afraid to speak on some of these, because these are tough issues, right? Whether it's you or someone else, if you want to man up, speak on it, right? That doesn't mean you have to, beat somebody up or whatever the case may be verbally, but, there's ways to approach these topics, whether you're talking to yourself or you're talking to your support system, whether you're the person who's speaking on behalf of someone else who's struggling with this. It's okay to talk about it. That is, in fact, manning up, not holding it in.
Tyrone, to bring it back to you just for 1 second, because now several times you've mentioned support system and you've mentioned community. And then when we talked about looking at different coping behaviors here just a few minutes ago, you did mention communities of color may be differentially responsive to identifying some of these mental health concerns or symptoms. And as we know, next month, so this month we're observing Men's Mental Health Month. Next month is B.B. Moore Campbell National Minority Mental Health Month, or BIPOC Mental Health Month, and MHA's toolkit has already been released. But I'm wondering if you'd like to speak a little bit more about beginning to identify those symptoms within communities of color and how that may differentially affect, one, self-recognition, two, the ability or capacity to reach out through a social support network for help, if that looks different, and three, if folks in the community differentially may seek different types of help. So not necessarily from a doctor, but from other people within their social support network.
Absolutely. I think that's a great call out. And the summer is definitely a time for a lot of awareness around mental health, which I think is amazing. I want to be, I have mentioned community a lot, and I want to be cognizant of those who have been more isolated, right? Don't have as strong of a community due to experiences, trauma, situations out of their control. I definitely think there's different routes to success for those individuals, but for those who do have a community around them, or what you may consider to be a community, it really starts with, who do you talk to, right? And this is independent man or woman. Who do you talk to? Who do you trust? Who do you rely on? Does that look like a friend? Does that look like a family member? Does that look like, someone who goes to your place of religious worship? Me personally, it would be church. Do you play sports, right? Are you in a rec league? Do you hang out? Who are those people that you talk to because they're a part of your community? You know, one aspect of your question was, are they necessarily healthcare providers? I do absolutely think that you should have a strong relationship with your care team and you should feel empowered to talk to them about these things. But, you know, often in communities of color, that isn't the case, right? There has historically been a less than stellar history between, you know, people of color and healthcare communities that I'm very glad is changing. But because of that, you know, you might rely on people who aren't necessarily your doctor or your therapist. And when you do talk to these people that you trust, that you consider part of your community, again, as was mentioned by Ryan, by Bernie, don't be afraid to really ask, you know, have you dealt with this before? I've been kind of feeling this way. You know, irritability is a big one. I've dealt with that a lot. So not being afraid to kind of talk to friends about that, talk to, you know, community members about that, and just have these discussions. And I think that's what it looks like sometimes. Oftentimes the intervention doesn't have to be intense, right? It could just be a conversation. I've learned a lot and I've made a lot of progress on my mental and physical health just from having conversations with people. They weren't really, you know, intense conversations. They weren't really, you know, tough to hear, but sometimes just one sentence or one comment made me change how I think about certain things. It made me look into options on how to improve that. So I think that's how it looks for these communities, because again, we have such a strong history. You know, I can say me as a Black man, there's a strong history of relying on extended families for various things. Why can't we rely on them to be a source of support for our mental health as well?
Thank you so much. So Dr. Ranchero, Tyrone, and Ryan really just told us a lot about where to start, right? When it comes to their personal experiences or at the community level. If you had to give a 3-minute elevator talk to someone who wanted to talk about their mental health concerns but didn't know where to start in terms of, you know, what treatment looks like, what options are out there, what are the tools in the toolbox that you can offer as a clinician, where would you start that conversation, or where have you started with men in your practice?
Sure, and it begins with oftentimes doing that screening, and oftentimes asking that patient. You know, I tell my patients, my goal as a primary care physician is that I want you to live a long time, but just as importantly, and more importantly, I want you to have the best quality of life with that. And are you living the life that you want to live? And if not, why not? And sometimes it comes down to, I take a strong family history, because we know anxiety and depression can be very generational, if you will, genetic. And asking, you know, do these mood disorders, do these substance abuses, do these behavioral problems, do they run in your family? Do you have people that in your grandparents, your parents, your siblings that might have these issues? And that identifying, and sometimes it's easier to identify in family than it is to identify in the individual. Then asking that individual, how have these things affected you? And we know that, yes, there are medications out there that we can use to help with those neurotransmitters, with those physiological changes that have occurred in your body with chronic stress and with chronic anxiety and chronic depression and other mood disorders as well. And we have new tools in our tool chest. One of the things is pharmacogenomic testing. So I can pair along with the medication, I can proactively test you and say, hey, you know what, before I just put you on a medication, let's see genetically what medications would be good for you. Let's also see genetically if you're even making enough neurotransmitters. Let's see how can we tailorize the medicine to you so that we're not guessing. We're making educated decisions based on evidence of how we can treat you as a patient. Now, not all primary care physicians are up to speed on some of these things, and you might need to go see a specialist, a psychiatrist, to get some of this testing done. But it's getting rolled out. A lot of these, and we in primary care are getting educated on it, on the different tools that are available. But even, you know, if it's talking to clergy on a regular basis, talking to a mental health provider, contacting Mental Health of America and getting help there if you don't have a support system. And you know what? Sometimes, as Ryan and Tyrone talked about it, just identifying it and say, fine, you can do it in confidence. Contact someone at an organization in confidence. No one has to know about it. And then over time, you can share that with others, because trust me, you're not the only one going through this. You're not alone. You're not alone. And so there's plenty of tools, whether it be medication with therapy, and other even supplements and naturopathic botanicals that can even help you there if that's the route you want to take. And getting involved with even getting in a support system, getting involved with a church or religious organization, getting involved with physical activity, improving your nutrition. All these things can help your mental health.
That's great. So it sounds like, right, there are many paths forward for men as they begin, I think the term journey can be overused, but their own mental health journey, whether that be through psychotherapy or talk therapy, or reaching out to family or friends or the support system, or looking at medications. And then we do have this new conceptualization. And by the way, I say new because I'm not sure if I'm dating myself, but I think right when I was getting out of college in 2003, we had just recently mapped the entire genome, the human genome, right? So between 2000, I think the late 90s, 2003 to now, there have been incredible advancements into understanding how some medications, can work. And it becomes especially important for something like a psychiatric or a mental health medication, because sometimes people are started off on lots of different medications and seeing if they work after 4 to 6 to 8 weeks, then having to try something new. So that does seem like something very promising, or as a tool in the toolbox. We only have a couple of minutes, left. I don't think we have any questions here in the comment section on our Facebook Live. But if I had to bring it back to this idea of masculinity, and drawing on your past experiences, what are some lessons learned from your own experiences about what traditional masculinity means, how that can be a barrier to asking for help or accepting help, if that case may be, from your community support network, from your physician? You can say it in like 30 seconds or a minute. Tyrone, I think we've already kind of recapped this, but if you had to summarize everything we just talked about in the last 45 minutes, Tyrone, what would it be?
Yeah, it's a great question. If I could put it simply, because I live by this, if something's going to go wrong, right? In this case, we're talking about mental health. If something's going to go wrong, you can deal with the ridicule from others or deal with it from yourself. And you can't fight yourself, right? You're going to lay up sleepless at night. You're not going to be able to eat, like all of these things that manifest as a result of depression or anxiety or whatever you're dealing with. You can't beat yourself, right? But if you bring it to other people, if you vocalize and you get support, sure, some people may kind of make fun of you, right? Be a man up. But that's going to subside, because eventually the help that you're going to seek is going to manifest, right? You have tons of treatment options, and it's going to make you better, and you're not going to have to fight yourself. So when you come into these situations, ask, do you want to fight yourself? Me personally, I don't. So that's how I look at it.
That's great. And I think before you even said, manning up is asking for help, right? I think you said that earlier. Ryan, how about you? Anything you'd like to add as a final thought?
Yeah, I'm coming from the place of being a dad and being a parent, and my message is put on your oxygen mask first, and related to the mental health. And so, being a parent, any parent, doesn't matter what sex, gender of parent, it doesn't matter what you identify. But for me, being a dad, that vulnerability is what's important to show my children that it's okay to talk about your feelings. And that is overcoming that traditional stereotype of manning up and not talking and not being vulnerable.
And Dr. Ranchero, how about you? Any final thoughts about the idea of masculinity and asking for help?
I mean, masculinity for me is acting despite the fear and having the courage and the strength to say, I want to change. And if you don't have that recognition, that I always say this to my patients, you are worthy of good care. You're worthy of love. And sometimes getting that patient to the point where they believe that, so I can work on whatever physical ailments they have, that they're worthy of it, and that you're worthy of good mental health, and that help is available.
Thank you all so much for joining this session today on behalf of Mental Health America and GeneSight. Really appreciate your participation. Really good dialogue today. For anyone else watching, you can, we talked a lot about screening and identifying emotions and mental health concerns. So feel free to visit Mental Health America's resources. Go to mhascreening.org and take one of our 13 mental health screens or mental health tests, and look at our other resources. Thanks everyone for joining. And again, remember, if you or someone else is in crisis, do call 988, the crisis response text and voice line. Otherwise, thanks everyone for joining today. We hope you'll join us for our next event. Thanks so much. Bye-bye.
Thank you.
Thanks, Nate.